Have you back, and we're going to find out a little bit about you because we never really talked about this before. You've been here a few times, but where are you from originally?
So I'm originally from Omaha, Nebraska, and I was brought up in a full-blooded Italian family in my father's restaurant. And my first job, I was 6 years old, and I got to stand on a milk crate and cook garlic bread. So you can picture a little 6-year-old just waiting for an order of garlic bread to come in. And it was hot, and but that's where I really learned the value of work, was to work in a restaurant. So a lot of times I'll tell my patients that have younger children, if they, you know, a great way to help children learn how to work is in a restaurant, whatever they can do, and that's where I learned how to take care of people, and you know, to be able to just service people, because as I say, life is about service, you know, and we're put on this earth to help others, and that's why I enjoy implant dentistry and helping seniors and doing dental implants and giving them back the smile that they really deserve and that they're entitled to, you know, especially seniors when they get in that twilight year and they can't chew, you know, it's just very, very sad, you know, so.
Right, so how long have you been practicing dentistry for?
This is my 25th year, so a quarter of a century, and it gets better every day. I'm learning more and more how to deal with people and how to really service them, okay? So, like I had a couple from Sebring drive 100 miles, and Sam and Helen, and they're just such a wonderful couple, and she had some dental implants, and the last one, she had them put in 20 plus years ago, and she found me on the internet and decided to drive 100 miles to come and see me. And so now I've done a CAT scan on her, and I had her in today, and we're gonna do some sinus grafting and place some more dental implants, so she can have that quality of life that she deserves. So every day I enjoy taking care of people, like I did in the restaurant business when I was a young child.
But what motivated you to get into dentistry? Was it an aha moment? You saw somebody that was having problems chewing? Or?
Yeah, you know, I've always liked working with my hands, and I just, you know, and when I was in the Boy Scouts in my sophomore year in high school, I went to an explorers group, which was at the dental school in my town in Omaha, Nebraska. And that's when I first started to really enjoy working with my hands, and we had a couple of real teeth that were poured in a block of stone, and we got to put some amalgam fillings in them, and that did it for me. I really enjoyed that. So.
And what does it mean to be board certified? Because you're one of only 500 board certified dental implant specialists in the world. So why is board certification so important to you?
Well, there's an organization called the American Academy of Implant Dentistry, and AAID has an ABOI, American Board of Oral Implantology, Implant Dentistry segment, and you have to take an oral and a written test in Chicago in order to become a boarded implant dentist. So in any board certification, if you have an orthopedic that's board certified, there's extended training that they have. Okay, so whenever you go to any type of doctor, if they have behind their name board certification, that means they've had more and more training, and I've had over 1,000 postgraduate hours in dental implant education. In fact, when I leave here after the show tonight, I'm heading to Gainesville for a 3-day implant training at the University of Florida Dental School.
So tell us a little bit more about the book.
Well, I've been working on the book for about 5 years, and what I've done over the years in Port Charlotte, Florida, I've done seminars, and I've done public seminars to teach people, educate the public about implants and the benefits of implants. Okay, so. And that was the start of it. I've done those for about 10 years now, and it's just so rewarding to see people, see the little old lady walk in and have the dentures in her hands, and not, you know, just not being able to chew or to get any good advice about what to actually do.
Dr. Gaeta, what makes you so passionate about people with missing teeth and also denture wearers?
Well, I see how much they suffer. people just really suffer, and they know. All you denture wearers out there, you all know how bad it is to try to chew. A lot of my patients, they won't even go out to dinner with people that they want to go out to dinner with. And I'm sure all the listeners, they know this. The denture wearers, and I've had patients, true story, open up, and this one little old lady said she'd open up the menu and she would say to herself, I can't eat this, I can't eat this, I can't eat this, and then they just settle for soft foods that they really don't enjoy. So my passion is to create awareness in the world about the benefits of implants.
What does it feel like to you as a dental implant specialist when you have someone that comes in and maybe they have no teeth or they're missing many teeth, and the first time when they have their permanent teeth in, that they look at themselves in the mirror? What does that feel like to you? That's
what life's really all about. Okay, that's the reward. It's not the money. It's to see the confidence come back in these people's eyes. And I had an old guy. He had a nasal cannula and he loved to bowl. And I gave him some dental implants, and he's since passed. But the neatest part about it was he had his best game ever after I gave him his implants. So it's such a confidence builder that they can go out to eat again with their friends, and and seeing our population is getting older and older, and we're living longer too. So it's about the quality of life, and when they smile, that's all the reward I really need.
So what about one tooth? If you're just missing one or two teeth, is that also going to impact your health?
Absolutely, because what can happen is if you lose, your teeth are dynamic. Okay, people don't realize that your teeth constantly move. Okay, so if you take one tooth out, the tooth can grow down. Okay, or the teeth next to it can fall.
5. All right, you have a couple of models here. You want to show us one of these and show us what happens, because you talked about bone loss.
Right.
Now, can you explain what this is?
Okay, this here is an example of the lower jaw, which is called the mandible. And if you look here, this is a jaw with all the teeth in it. Now, these subsequent jaws are a time when after the teeth are removed, this is what happens to the lower jaw over time. Okay, so you can actually go from here to here over a certain period of time, and once you lose a tooth, you lose 40% of the tooth. The supporting bone is lost within the first 4 months. So the only way you can stop this is with a dental implant. Okay.
Now, why is it so important, though, to stop the bone loss? What can happen when you lose the bone?
Well, for denture wearers, all you denture wearers out there, what can happen is there's a number of things. Your denture can get loose and continually get loose. Okay. And you can get something that's called premature aging. Because of the bone loss, your face will look more sunken in because the bone resorbs back and down on the bottom jaw.
Well, people are living so much longer now, but how many people will have their own teeth for their entire life?
Well, right now, 2 out of 3 Americans experience some type of tooth loss. Okay, there's statistics out there, and tooth loss is directly related to age. So for all the baby boomers who are gradually getting older and our population is getting older, it's something that we have to look at. Okay, because one thing that isn't talked about a lot is that life expectancy has increased since World War II dramatically. So there's the mindset hasn't caught up with the fact that people in their 70s are going to live to be 90, and people in their 60s are going to live to be in 80s and 90s. So the older population, we're not passing away as quickly as they were before World War II.
And of course, What about people that lose their teeth at a young age? Are they also going to be as affected by it?
Yeah, absolutely. That's, you know, if I have a younger patient that has a tooth that is unrestorable, so to speak, and you can't put a filling in it or save it, and they lose that tooth, what we all need to do as a profession is to let them know the consequences of losing that tooth over time. They might not be able to get a tooth replaced, an implant right away, but it's something that they need to be aware of the consequences.
Now, you've written this book, and I believe your book is available at Amazon.com.
Yeah, it's coming out real soon.
And it's called Your Missing Teeth Are Killing You.
Right.
I mean, that sounds so drastic, and it sounds a little scary. But how will, over time, this really impact your health?
Well, Harvard has done a study where you can lose up to 9.8 years off your life due to inability to chew for denture wearers. So if there's folks out there that have dentures, you're going to lose, the studies show that you'll lose years off your life. And it's usually due to mastication. It's usually due to the fact that you can't chew healthy foods, and then we resort to you know, carbohydrates and empty calorie foods, so to speak. You know, no fruits and vegetables.
Sure, like sipping soup or just sipping juice or drinking
pastas
water.
and
gumming
things that are
foods.
Soft. Yep, gumming your food. Things that are soft. So.
7.5, and now we're going to start talking a little bit about the dental implants that Dr. A.Gaeta does, because basically you can go in and you can either have conscious sedation or you can be completely under, their choice, right?
Absolutely.
And they can leave that day with teeth.
Right, absolutely. They, you know, people that have dentures, they don't realize that there's hope for them, okay? And usually if they have dentures or if they've lost a tooth, they have some level of fear. And what we do is we do conscious sedation or IV sedation. They call it twilight sleep. There's a number of terms for it. But what that does is that relaxes the patient so they can get through the procedure.
Are they aware of what's going on? You say conscious sedation. It sounds like you're conscious, but are they actually aware that you're in there and you're doing your thing?
No, they're amnesic and they lose track of time, and they really don't care, and they have a really good experience going through it.
Now, is it a painful procedure?
There's some discomfort, okay, with an implant, but the implant is placed in bone, which has no nerve endings, so there's minimal discomfort.
All right. I have a little email question that was actually sent in by one of our viewers, and I'd like to read it out to you. It says, my friend is getting implants for her entire mouth, and she just had all of her bottom teeth pulled out and the post put in for the implant. So this was not by Dr. A.Gaeta, by the way. The doctor was going to put temporary teeth on the post, but couldn't because he found that her bone was too soft. Now for the next 4 months, she's going to have to use a contraption that they'll build for her to replace her bottom teeth. And is there a test that could have been done to identify that problem? Like, couldn't they have told that she had soft bone before they went and yanked all her teeth out and done something about it, Dr. A.Gaeta?
Usually you can do a test called a CAT scan, okay? Just like you can get a CAT scan on another part of your body. And we use that diagnostic tool routinely to determine bone density, okay? And there's a unit of measurement called a Hounsfield unit. And certain dental CAT scans will give you the bone density of Hounsfield units, and you can determine bone density from that.
Dr. A.Gaeta, let's talk about some of the success stories that you've had.
Okay, sure, absolutely. I've had, like Herman, who we had on the show one time. Herman is 86 years old and just a wonderful man who had dentures, and he got to throw his dentures away because we placed dental implants, and I've just seen his whole life transform. You know, has a new girlfriend now, and it's really it's wonderful to see the transformation and the confidence that people have after they know they can go out to eat with their friends, they can chew whatever they want to chew, they don't have to go into the bathroom and take their teeth out and rinse their mouth out. They can go, I had a patient who said that she would she wanted to drive. She would, if she went out to eat with her friends, she would insisted that she would drive so she could drop everybody off and take her teeth out as quickly as possible. So there's Loretta. Loretta, I threw away her partial. She had a partial denture that you take in and out, and you can eliminate those with dental implants.
Never have to wear them again.
Never have to wear them again.
All right. Let's talk a little bit about that denture adhesive, because I know as a woman, I don't have dentures, but I wear lipstick. And I read somewhere that you swallow X amount of pounds per year. What's the deal with the denture adhesive?
The same
That's
thing.
right in your mouth.
You know, there's a lot of people that, you know, I do a lot of public seminars in the area, and, you know, the denture wearers, you guys know that you place the adhesive in, and then towards the middle of the day, you may have to place some more, and you know, where does that stuff go? And there was a national TV channel that did a segment on neuropathy and denture adhesive and how it was directly related to the zinc in the denture adhesive. So if you want to eliminate the denture adhesive, come and see us about dental implants, and we can throw that denture adhesive away. No more denture adhesive.
And what if somebody needs both uppers and lowers, but they're missing some teeth on the bottom, but they're missing all their teeth on top? Would they be better off getting the full upper ones done in one fell swoop and waiting to get the lowers done?
Well, it just depends on the individual patient's wants and needs. If they come to me and they have a bag full of upper dentures and they just can't seem to wear them, and they're very frustrated, and they use a lot of denture adhesive, you know, we'll probably want to start with the uppers first. You know, so it depends on the individual needs of the patient.
Getting the dental implants put in, is it a safe procedure?
It has the highest success rate in dentistry today, higher than root canals, higher than crowns or bridges, and it's become the standard of care for missing teeth in dentistry today. Now,
do dentists know about this to be able to recommend people to you as a dental implant specialist?
Yeah, absolutely, and all dentists can place implants, you know, but some are more trained than others, okay? And just like if you go to a doctor and he has board certified, you know, behind his name, the board certification indicates that you've taken some extended postgraduate training and usually a test like I had to take to become a board certified implant dentist. So they have a little bit more education.
How long do these dental implants last?
Well, I just went to a seminar last weekend, and they can last 30 years. Okay, so they actually, when I first started training, my first mentor was a wonderful man in Port Charlotte, Florida, and he would call me over and he would show me cases that he had done years ago, and the teeth around the implants would be decayed and the implants themselves would still be standing. So.
Is it possible then, if you have the posts for the implants, because you put the posts into the bone, can you just replace the teeth on those existing posts?
Sure, absolutely.
So you don't have to go in and drill or do any of that stuff?
No. You know,
wow,
an implant is actually a titanium screw, and it's a man-made replacement for the root of your missing teeth.
Do you have a little model here? You want to show this?
Sure,
this
I'd be
is
happy to.
Let's
a model
see what that is.
About actually shows some implants here, and in this particular situation, you can have implants placed and then have a fixed bridge put on it. Okay, so and here's another one here in the front. So there's all different types of treatment options for dental implants. You can either replace a few teeth. Let's say you have all these teeth here, and you need only a few on one side. You can do that with the dental implants rather than having something that you take in and out of your mouth.
And we should probably point out to our viewers that right here, you're not going to actually see those screws there. That's just kind of mimicking what's going to be underneath
That's just
the
some clear so you can see where the implants are and where they're placed. Right?
How long does it take to do the procedure? If you come in that day, are you going to leave with something? Is it 4 hours, 6 hours?
That's a common question, and you never have to go without teeth. So a lot of people ask me, do I have to go without teeth? And you don't. okay? I always make sure that you have something in that area. If I place one single tooth, I will a lot of times bond a tooth in there, and I will anchor it to the adjacent teeth. So when you walk out and you smile, there's no gap there.
So when you leave, are you leaving with the actual teeth that you're going to be wearing, or do you wait for a little
sometimes,
bit of a...
Sometimes you do. Yep, sometimes you do. Most of the time you can, we put a temporary crown or some type of temporary appliance in until the implant is fully integrated into the bone, so to speak.
All right. Dr. Gaeta, you come in, what should you expect? For someone that's, maybe they're scared of going to the dentist.
Right.
We know you're friendly. Tell us a little bit about your staff, what to expect.
Well, the initial meet and greet, so to speak, is I like to get to know my patients, where they're from, how much fear level they have, and we take all that assessment before they come in. So I know a lot about my patients before I even meet them. They can also go to the website, siestasmilesdentalcare.com or celebritysmilesdental.com, and learn a lot about me, and see pictures of the staff and various procedures we do. And then my number one goal is to keep them as comfortable as possible.